Hi, I'm Dr. Sridhar K. Hope you're finding the snippet series useful. In this video, I will describe briefly about nappy care in babies. The nappy area is very sensitive, and obviously because of the increased exposure to moisture from the urine and the stools, there is a high risk of skin breakdown. The stool is not sterile, it has many bacteria and even fungal organisms, and when the skin breaks down, they can enter into the skin and cause a secondary infection. Babies also go through a physiologic lactose intolerance in the first 2-3 weeks of age when they are getting used to digesting the breast milk, which is predominantly having lactose sugar. So the skin starts getting irritated more, and if the skin gets broken down, the acidic stool can be stinging and the baby has discomfort and cries. So the approach to the nappy care is straightforward. During the initial phase when there is meconium, you don't need to do much because the meconium is thick and greasy and it's not as frequent. However, once the milk starts coming in, the stool starts getting watery. The explosive stools come up in babies during this physiologic lactose intolerance I mentioned. You may have frothy stools, which are the acidic ones. And in this case, you have to start using preventive barrier cream. So barrier is nothing but something which protects the skin from moisture-induced damage. Most of the barriers have a combination of zinc oxide in different percentages, usually 10% or more. And we also have paraffin and some moistening effect. So which brand you use is not very important, but you may be deciding that based on the texture and the consistency, how easily it is removed and so on. So some parents try a couple of barrier creams before they decide to continue to use one. You do need to continue to use a barrier cream on a preventive basis till the stool frequency is increased. One important tip that parents need to remember is that babies have a very active gastrocolic reflex, which means when they feed, they tend to pass stool. So even though in the first week we encourage you to feed every 2 hours or so to stimulate your output, once the milk output is reached, you try to pace the feeds reasonably. Obviously it's going to be demand feeding, as we have discussed on the video on feeding pattern, but you try to avoid overfeeding. Overfeeding leads to more colic and it also leads to more stool frequency, which can upset the baby from the nappy rash point of view. If the skin starts breaking down, you need to be aware of exposing to the air to some extent. Wipes can be exerting undue pressure. So whenever we use a wipe, we don't realize that we are actually pressing on the skin. So when the skin is fragile, you start using just cotton and water, and that will be better for the skin, especially if it's broken down. If you are using wipes, especially if you're new parents, be aware of the pressure that you use, because you can easily press on the skin to clear, and you should be very gentle with the skin. So because pressing on the skin removes the surface and it's predisposing you to breaking down the skin, which leads to the infection and so on. If there is small red spots around the nappy area which are spreading, it might mean there is a fungal infection. It may need specific treatment. And it's not uncommon to have a bacterial infection as well when there is redness with the peeling skin. We often use a combination of antifungal and antibacterial, possibly with a mild steroid, to treat when it is stinging the baby and the skin is broken down. But it should be under supervision of a physician, and it should be for the shortest time possible. So don't over treat the nappy rash. And these creams, if they have a steroid, you shouldn't exceed usually 5 days. And there are some combinations which have strong steroids. You should not use them in the newborn stage. So be aware of what preparation, follow your physician's recommendation, and hopefully it will heal. Some rashes are recurrent, and that might mean that you may need to review the feeding pattern. You might need to, if you're on a formula feed, you may consider a lactose-free milk for a period of time, or a low lactose comfort milk. But if you're on breastfeeding, you adjust the feeding pattern, look after the skin well, and hopefully it will resolve. I hope this is useful. Please share.